Hi, thank you very much for coming into this first MedTech Festival. My name is Chris. I'm representing the Future of Medicine to be your host for this exciting festival. And apparently, you might be able to tell that this is the first MedTech Festival in HKU. It's probably also one of the um, more exciting ones in Southeast Asia as well. And MedTech is, of course, of increasing importance and will definitely continue to be more important in the upcoming era, which is probably why you're here today. And we are very excited to have you here today so that we are able to create our futures together through the power of MedTech, or at least to understand how it's going to shape our future as well. So here's our schedule today. There's a bit of modifications due to the availability of speakers. So at the beginning, we'll have an overview series, which will be talking about why MedTech matters in the future of medicine. Zach is going to talk about, give you a brief introduction to AI. And Betty is going to talk about synthetic biology in cancer. Orange will talk about imaging techniques for cardiac characterization. And finally, we'll also have Zach talking about the exciting field of RNA therapeutics, and you all have the chance to do the Q&A session at the end of our talk. But in case if you have any burning questions, just feel free to put them in the chat box or just give us a shout. So let's get started. Why MedTech ever matters in the future of medicine, or why this festival ever exists. So one of the more important questions that we want to know is about considering who we are as clinicians of the 21st century. Do we just want to be doctors who follow guidelines, or do we want to be doctors who are going with the flow and, let's say, follow whatever path that our peers are doing? Or do we want to be trendy doctors who are following and using every single latest technology, like what people do with iPhones? Or do we want to be doctors who are going to shape the future of medicine via the power of MedTech actively? So this is certainly up to you and up to your preference, because we all have our choices and options, and each type of doctors that whether it is a guardian of guidelines, the followers, the trendy doctors, or the tech developers, all have its importance in the role of either the present or the future of medicine. And when considering the paths ahead, it is also something that we might take into consideration. It's also about the healthcare challenges or opportunities, coincidentally, which they are actually the same, that we are going to face in the upcoming 21st century. And here we have a non-exhaustive list of obviously aging population and the rise of non-communicable diseases is something that we are going to face and is facing, which calls for the need for novel cures as well as diagnosis and prevention of diseases. We're undergoing digital transformation of healthcare. We're seeing a lot of AI, big data, genomics, and telemedicine going around. It's probably easier to see a doctor via your smartphone than to, let's say, have a 6 months GOPCQ. We are also facing healthcare inequalities in nowadays, especially among the less privileged communities, which we are calling for public health, as well as the need to improve healthcare accessibility. And we are also dealing with emerging epidemics, microbial resistance, as well as the ongoing COVID pandemics, and perhaps a suspension of classes as well, which calls for the epidemiology, advanced modeling, and also novel cures and vaccine prevention techniques that we need to deal with all these healthcare challenges and opportunities. And these are just a short list of them, of course, important. But let's say I know there are so many problems here and opportunities. So what is the role of MedTech and why is it relevant at all? So essentially, it is something that we need to understand is that biomedical technologies, or essentially advances, provides us the tools that we need to tackle all the challenges. And essentially, from a historical perspective, it is also something that has helped us tackle many challenges of the past and the present. And essentially, it's also one of the major driving forces, if not the most important force of the modern medicine. I'll just present you several examples here. Electrosurgery, something that was invented in 1920, which is very important, especially in improving the clotting, preventing the overbleeding of the surgical procedures. At that time, they were working on brain surgeries, trying not to bleed out the entire brain at that time. And essentially, it's also one of the most important things that modern surgery is employing. Penicillin, you're probably very familiar with the story. This sudden discovery of this special molecule eventually becomes a cornerstone of antibiotics that has helped treat a lot of biological infections. Cardiac catheterization is also something that's certainly very important. Computed tomography reformed the entire field of medical imaging and diagnostics. And up to the modern eras, we have RNA interference, allows us to shut down the genes, or the mRNA expression allows us to modify the molecular biology that we want, and mRNA vaccines of the latest, which obviously helps us a lot in dealing with the COVID pandemic. And it's also something that has helped shape and is shaping the path that we are going in the modern medicine. And I'm sure Zach is going to talk to you more about the RNA parts or in the subsequent parts of the talk. So we know the past, so what will be the future? And artificial intelligence, I'm sure you all have heard about it, and it's something that is among one of the most promising and most mentioned technology that is coming up in the upcoming or the present part of medicine. Zach will tell you more about the AI afterwards. Essentially, there are companies who are working on AIs, including stroke diagnosis, biomedicine, AI dermatologists for cancer diagnosis. We have a long list of AI radiology, surgery. Surgery probably needs a bit more time. We also have pathologies, cancer, or cures, or even applications of medical education has also been ongoing as well. The other thing that we have is telemedicine. Telemedicine is not just limited to virtual consultations and remote health monitoring, but it's also coming up on remote controlled robotic surgery. So essentially you can do a surgery when, let's say, eating your breakfast in Paris when you are operating at Premier Hospital. Imagine that possibility that you can go travel, which I don't think it's something that is very promising nowadays. Genomics and precision medicine is also something that's up and going. We have next generation sequencing allows us to sequence DNA and RNA sequences. We also have all of the patients. We also have the portable versions by Oxford Nanopore, which you can essentially just plug in the chip into your computer and do the sequencing in a very cheap manner. Of course, there are more upcoming advances, for example, DNA and microarrays that allows us to know much more about the patient's genes, and essentially maybe this will allow us to design a cures based on the patient's genome data. Immuno and targeted therapy is also something that becomes more and more promising and mentioned. For example, we have CAR T-cell therapies, which essentially basically we just extract the T cells from the patients, insert the genes for the chimeric. The CAR stands for chimeric antigen receptors, and essentially what these receptors do is that they allow the T cells to recognize the cancer cells and the antigens and subsequently act them. We also have a list of antibody therapies, which allows us to tackle either the tumor surface antigens and receptors. It can also trigger the immune reactions, modify the tumor microenvironment. So these ones are some of the very promising techniques that we are going to develop and have made significant progress in them and tackling especially fields related to oncology. And gene RNA therapies are also something that is coming out very rapidly. We have the latest mRNA vaccines, we have RNA interference techniques, which we just mentioned. Something about gene modifications also includes a CRISPR-Cas9. Of course, there are ethical considerations, especially when you are trying to modify the genes of embryos, which could get you in jail if you don't do the ethical approvals properly. But essentially, these are becoming more and more promising techniques that allows us to treat diseases that we are currently not able to treat. So possibilities would include individualized gene therapies, whether it can apply it to cancer cures or treating rare diseases with specific gene mutations, or the other way that it could go, it's the possibility of gene-specific bioweapon that we can make use of nanotechnology, and perhaps is it going to kill or eliminate humanity or being used in genocide like the films do? That would be something that we have to consider as well. So for future of precision medicine, what that holds, we can sequence the genes, we can design patient-specific therapies. So can we design, let's say, patient-specific precision therapies when we are on demand or when after the patient gets a diagnosis? That's something we would have to wait and see, or you have to go and explore. And other than precision therapy base, we also have a lot of advanced biomaterials, including nanotechnology for drug delivery, which we can, which basically acts like a cargo shell that's going to ship the drugs around. We can design, we can choose what cargos that we like to deliver. We can also choose to modify the package itself, whether we want to decorate it with ligands, etc., so that it's going to act like a taxi that's going to ship the drugs to your specific target cells that you like. Or it could also act like a Trojan horse to help us cross barriers that we find very difficult, for example, for the blood-brain barrier. The other thing would be the 3D printing advances. So here is a 3D printed lungs, the alveoli, but essentially we can also do much more, for example, printing the entire organs, printing cells, and etc. Allows us to do artificial organs. And we also have regenerative medicine-based approaches. You know, the heart is particularly difficult to heal, but nowadays we have a stem cell-based heart repair patch, which we can use stem cells to differentiate into beating cardiomyocytes to repair the heart after myocardial infarctions. We also have medical imaging advances and biosensors. We just mentioned about the AI applications, which essentially bridges many fields, automated image segmentation, interpretation, and we also have a lot of wearable biosensors, which could give us a lot more physiological data that we can obtain, for example, glucose, lactate, ECG, even hormones or immune markers as well. That gives us much more data to understand much more about our human physiology, and essentially the commercialization and availability of these biosensors to the general public. We have the ECG as well, the pulse oximeter on the latest version of Apple Watch. I'm not doing any advertisement here. That would allow things to allow much more accessibility to the general public of the latest technological advances. Surgical techniques is of course very important sides. So we have remote control robotic surgery, as mentioned. We also have AI assisted surgical planning that allows us to decide they have a better precision on the size of, let's say, it's spinal surgery, the implant size, the angles that we want to work on, so that we're not just going to blindly insert a let's say implant into, and when we're trying to repair patients, and essentially this could potentially give us a better precision and outcome to a patient's surgical outcome. And maybe in the future, we may be able to see fully automated AI surgery as well, which of course scientists and engineers are working on them very rigorously. Human bionics is another advance. This is a pair of bionic arms. This is Tilly Lockheed from Open Bionics. She lost her arm, both of her arms due to sepsis, and correct me if I'm wrong. And essentially, this Open Bionics allows you to control the movement of your arms, or hands based on your thoughts. And essentially, this is something commercially available that you can purchase. I think it's costs around several $1,000s, so it's pretty affordable. We also have bionic legs, which you do the EMG, which can allow you to control the pair of legs using your thoughts as well, by inserting some surface electrodes around the knees. We also have mind control exoskeleton. This one is a tetraplegic patient in France, but after inserting 2 brain implants beneath the skull, he is able to walk again by controlling the movement of exoskeleton via his thoughts. Of course, there is a lot of further steps that we need to do about it. But essentially, the future is getting closer and closer for either a better recovery for patients, or essentially letting those who cannot walk again. And whether full human bionics that we see in films will be a reality, that's something that we will be keeping an eye on it. So we have artificial organs, we have artificial limbs, artificial hands, and leg, arms. So could we have artificial trunk, head, and neck, possibly brain, and artificial humans as well? That's something that we may possibly be able to see in the upcoming era of future medicine, and managing patients by inventing personalized cures on the spot, as mentioned. Whether that could be a reality, or it could be something that we do in our day-to-day medical practice. It's going to be something that's partly up to the technological advances and partly up to you to decide whether you're going to be a part of this exciting field. And eventually, I can illustrate an example. For example, Ted, male, 55 years old, admitted to A&E after seizure. He got diagnosed by glioblastoma, which is commonest and aggressive primary brain cancer. We don't have any cures, and having known that we have so many technologies available, can you make use of them to design the cures for them? Can we, let's say, make use of sequencing, nanotechnology, regenerative medicine, or RNA or gene-based therapies to give TED a cure? So we'll come back to the core question. So why MedTech matters? Because it is the past, the present, and the future of medicine. And MedTech is an interdisciplinary field between not just between healthcare professionals, but also with having a strong intersection with scientists, engineers, business, entrepreneurship, and many more disciplines ahead. So if you're really interested, so what can we do to shape this future using the techniques? Most important thing is always about exposure, go to labs, speak to people, perhaps do further training, let's say biomedical engineering, healthcare informatics, or either bachelor's, master's, or PhD degrees could serve your purpose depending on your diet. And that's all I have to say. And thank you very much. So sit back and enjoy the show. We'll have Zach coming up to talk about AI right afterwards. Thank you.